whenever there is travel planned to a area that is considered chloroquine resistant. If not mefloquine, and if it is not tolerated, or if there are contraindications to mefloquine, then you give etoquapone and proguanil combination. So the first choice would be mefloquine, and if there are contraindications to mefloquine, if it is not tolerated, then you need to give etoquapone and proguanil combination. But in most of the areas are resistant to chloroquine, so mefloquine is considered as the drug of choice for prophylaxis. This is in an emergency standby instructions that you would give them is particularly if there is flu-like symptoms that she has and there is no medical excess in 24 hours of symptoms and the temperature is she's running fever, etc., then you can advise them to take tablets. Quinine and clindamycin can be considered to be started empirically, that is without diagnosis. So this is something that may be asked: quinine, clindamycin. Mefloquine, which we have given for chemoprophylaxis, has to be started again after the treatment is complete. Because particularly if we have not established the diagnosis, so we start with quinine and clindamycin. So this is when a lady goes to a sub-Saharan Africa, for example, any country there, and then there you get fever, flu-like symptoms, and you cannot rule out malaria. You do not have access to any medical facility. You can start empirically quinine and clindamycin. So this is the D point, okay, the diagnosis and treatment. These are various clinical manifestations and lab manifestations of severe complicated malaria. Now, what is important for us to understand here is that the treatment of malaria depends on type of malaria, whether it is falciparum or non-falciparum. And the second thing is the severity of malaria. So severity, how do we know? It is based on your clinical symptoms or your clinical findings as well as lab tests. So clinical findings like impaired consciousness, respiratory distress, pulmonary edema, multiple convulsions, circulatory collapse, shock, abnormal bleeding or DIC, jaundice, hemoglobinuria. So these are various clinical symptoms suggestive of severe malaria. So any of these, if present, you know that the malaria is severe and you have to treat the lady based on severe malaria.